Something that COVID has taught us is that we are very dependent on our supply chain, right? We have to get goods, it needs to be delivered, and a big part of that equation are truck drivers and the driving, our system of driving and transportation here. So we are very fortunate today. We have two people that are in the industry, and what I'm going to do is I'm going to toss it over to each one of you just to give me a brief description of who you are, your title, a little bit of your background. This way, when you're talking, the video is on you, so it's not just me explaining it about who you are. So we'll start with you, Joe. If you don't mind, just tell me a little bit again who you are, your title, and what's your role in this whole thing.
Sure. I'm Joe Sculley, president of the Motor Transport Association of Connecticut. MTAC is a statewide trade association representing more than 500 trucking companies, mostly small businesses, but also we do have a number of the big guys, so to speak, including UPS and FedEx. And you'll hear from a terrific FedEx driver, Roland, in 1 minute. And even though Roland will speak, I want to just tee up because I know he's too humble to do this himself. He is a grand champion truck driver. He's won the national truck driving championship. He's won many state truck driving championships in order to get to the national event. And he volunteers with a number of state events. He just lives and breathes this stuff. So he is one of the best, safest truck drivers that we have out there. So that's why I wanted to have him talk here today. So I'll end it there and kick it over to Roland, I guess.
Yeah, so Roland, I guess I could call you the Michael Jordan here of truck driving, but if you just give us a little bit of a description of who you are, what you do.
Hi, I'm Roland. He just said it all. No. I drive tractor trailer for FedEx. In the morning, I'll bring airplane freight to one of our stations, whatever comes in overnight. And then the rest of the day, I'm out making deliveries, delivering everybody's heavyweight items, businesses, residentials, things like that. We're the essentials delivering your essentials.
So Roland, let's just start right at the punch here. What has changed for you since COVID? What about your job has changed?
Well, we're definitely wearing masks everywhere we go. Got to wear the mask. If you don't, you get looked at kind of funny, which that's fine with me. Safety first, always safety first. What has changed, a lot of locations, you can't go in and use the restroom. You can't wash your hands before you go to lunch. I do have a lot of great customers. They will let me break their rules and use their restrooms. But a lot of other places that are not my regular stops, you can't use the restroom. So that has changed. But as far as trucking itself, everything's moving. The trucks are on the road. The trucks are delivering the products that everybody needs. And, it's kind of nice not having cars on the highway, but the trucks are moving a little freer because there's less traffic, but they're doing a great job of delivering everybody's products safely.
Yeah, so that's right. I mean, you told us the pros, and obviously you were very positive about it. I'm going to jump into some of the challenges, though, and you mentioned restrooms are one. What are some of the other challenges that you're facing? I mean, I'm even thinking about food. Are you able to stop and get food easily? How are the actual trucks stops? Do you feel like they're being maintained? Just talk to me a little bit about some of the challenges you think there are now on the road.
Well, I do frequent one of the truck stops in Branford, Connecticut. They're still open. The restaurants are still open. You can't eat in the restaurant. They have a Subway, a Popeyes, Starbucks. Everything's still open. So you can still go in and get things. You can still buy products at that TA Travel Plaza. But as far as like the fast food industry, those restaurants, it's kind of hard fitting this thing in a drive-through. And that's the only thing that's open. So we can't frequent the fast food restaurants. Lately, I've been bringing my own lunch to work, so it doesn't bother me.
Adam, can I add one thing on that, if you don't mind?
Please do.
As far as the drivers being able to get food out there. One of the things that has happened, I'm pleased to say that we worked with the state DOT and also the Federal Highway Administration to allow food trucks at state-owned rest areas. that would not normally be allowed under federal law, but given this emergency that we're in, and I think there's widespread recognition that the drivers are having trouble finding food. You just heard from one who said that. So the federal government said, if states want to allow food trucks to set up at rest areas to provide another option, they can do that. And Connecticut was one of the first states to do that. They jumped right on it. I've been down to a couple of locations, and I'm actually planning something for next week at another one. So I just want to credit the state for recognizing that and acting to provide another options for the drivers who, you know, can't take their tractor trailer through a fast food drive-through or who have no other options.
Well, Joe, thank you. And actually, this lends itself well to the next question here. You mentioned one thing the state is doing well. Is there anything else that you can think of that you think Connecticut has been ahead of the curve, doing well when it comes to the safety, the convenience of truck drivers coming through our state?
Yeah, I think the state has actually done a very good job throughout this. Thinking back to when this first started to get real serious, and we had, this may have even predated the stay-at-home order. There was kind of a run on grocery stores, right? The shelves were empty, and we worked with the DMV and the administration to say, look, our grocery distributors have food in their warehouses, but they can't drive anymore due to compliance with federal hours of service regulations. But in times of emergency, governments, whether it's the federal government and or the state government, can waive those if the trucking company or the motor carrier is acting in response. So in this case, we've got empty store shelves because of the public health emergency. So grocery distributors were among other kinds of operations that were allowed to drive overtime. And they did in order to refill the shelves. So that's one example. There's also a emergency overweight permit. Again, if I can fit more food, just as one example, on my truck so I can take fewer trips, but I might be required to go overweight to do that, you can apply for a permit to do that. So again, I think the state's done a good job with a number of things. Those are just a couple examples. I think there's more that are not coming to mind right now, but so far so good.
And of course, that's very reassuring. The state is, making this, it seems like a priority. Though this question is going to go to either you, Joe, or you, Roland, seeing it firsthand. What could the state still be doing better? I mean, is there room for improvement? There usually is, right? So what are some of the next steps you think that the state needs to be doing? And maybe even thinking long term. I mean, we're doing well right now, but there's going to be some more longer term issues. What's coming to mind?
Roland, you being out on the road, do you have anything to add first?
I would love to say they should be out here fixing the roads while the cars aren't out here. They're doing it. It actually took them a couple of weeks before they really dug their heels in and started working hard on it. They're doing it now. Down in the New Haven area, they got a lot of construction going on. Great that they're doing it ahead of the summer rush, before people get out on the roads and start moving around, before people come out of this quarantine. Now's the time to get some construction doing. And they're doing it. So the state, they really are stepping up. I really haven't seen too many places or too many things that the state could be doing different, in my view.
You, Joe? Yeah.
I would concur with that. And I would just say, I think if there's any area of concern, it's about going forward. Let's make sure that we keep making good calculated decisions. I will say I am hearing from some members who have operations in a bunch of states who either see states doing or thinking about doing things like a mandate where the employer puts everybody in line, every employee in line, and takes their temperature before they walk in. That's kind of counterintuitive if we're trying to practice social distancing, right? You're getting everybody together where you could be spreading this thing. Not to mention that people could be asymptomatic, and just because you don't have a fever doesn't necessarily mean anything. Also, since trucking is one of the essential industries that are operating, we're already operating right now without this mandate. Now, some businesses may choose to do that, and that's fine for them. But I just think we need to be cognizant of potentially too heavy handed mandates as we move towards this reopening. So that's just something to think of going forward.
And so, Joe, I mean, I'll throw this one back at you because you're on this train of thought here. You know, the drivers are having to stop, unload, deal, interact with somebody. I mean, the masks are going to get us so far. I mean, we have to find a balance, right? Checking temperature might be a mandate that's going to be hard to enforce. It's going to cause these delays like you're talking about. But of course, you have to think of the safety, you know, drivers going across the country, stopping at these different locations. Like, what is the way moving forward?
Well, I think some of the things that they've done even recently are okay. I haven't heard anybody complain about face masks. Okay, gloves, hand sanitizer. The only problems along those lines that people may run into is they can still be hard to get. Roland and I have a good friend who's a driver who goes down into the New York City area who said, this was weeks ago, I want these things. You don't even have to mandate them for me. I want them, but I can't find them. My employer can't find them. So if we can make sure that that is continued to be phased in, if there's availability of these supplies and they get to the right spot, I think that will go a long way to keeping us safe and healthy.
So this question could go to either one of you. And, you know, there's a saying in journalism, not to bury the lead, you know, start off with the most important question. So I probably should have led off with this. You know, why is it that I'm not able to get toilet paper? You know, in other words, is it a supply chain? Is it a supply problem? We're just not making them enough? Or is it a supply chain problem, being that the drivers have to prioritize food, or there's just not enough drivers right now on the road to meet that demand, or the drivers are getting sick? I'm just trying to figure out where's the breakdown where, you know, the toilet paper is not coming from the factory here to the stores.
I think that's coming from the people on social media. Right off the bat, social media turned around and said, you know, somebody started this up. We need toilet paper. Everybody went out and bought toilet paper. If they turn around and said, tomorrow, we need chicken, you'd run out of chicken on the shelves. It's really is this, you know, we've never dealt with social media. I mean, the pandemic is something that we've never dealt with, but the social media aspect of it really is instant. Everybody sees it, and it grows like wildfire. Even if it's incorrect, it grows like wildfire. So the truck drivers, I saw the line down in Georgia at the, I think it was a Kimberly-Clark facility. It was 2.5 miles long, trying to get in, to get the toilet paper, to get out. They're moving the toilet paper, but as soon as it hits the shelves, everybody hoards it. Joe had a good line. I got to steal it from you now, Joe. A friend of his told him, he said, things will start getting back to normal when people start acting normal. Yeah. That is such a great line for that problem.
So what I'm hearing from your experience is that it isn't a supply problem, because you said that the line was out the door at that facility and it seemed like they were getting stocked, and you
and
in your opinion that there was lack of drivers. It really is just the supply chain problem is at the user end, on your at the consumer end, in your opinion.
If everybody's going to run to the store and buy one particular item, they're going to empty the shelves on that one particular item. And where was everybody going to the bathroom prior to this? At work? You know?
Yeah, it's just it's this unexpected aspect of this that is a big problem. And another good comparison that I've heard is think about the Thanksgiving holiday, right? Leading up to that, there's much more food is purchased, but we have that every year at the same time of year. So the manufacturers, the suppliers, the distributors, they all know it's coming and they ramp up production and they get ready for it. With this, I don't think anybody really saw this coming. And so the toilet paper manufacturers may have needed a little bit of time to ramp up production, add employees if they can find employees who are healthy and ready to go and can get trained and do the job. So I really don't think there's any issue in the supply chain there. I kind of like what the grocery stores, at least the ones that I've been in, have done and said one per person. I think that just makes a ton of sense because we haven't got past the the panic part of this yet. If there's only 3 left on the shelf, one person is going to buy all 3 because they think it's the last time they're ever going to see it. But so instead of that, you have 3 different people who may be able to get some. So I kind of like what the stores are doing there.
So, I mean, Roland, based on what I'm hearing is that it seems like drivers still out on the road has not become an issue yet, but let's talk about some of the worst case scenarios. What happens if drivers are starting to get sick? What if there are less of drivers able to complete the job? I mean, I know we know that it's going to cause problems on the other end, but I guess another way of me asking this is like, what keeps you up at night as far as your job when it comes to drivers, and what could go wrong?
My job, not much keeps me up at night because, well, I'm healthy, number one. I'm keeping my family healthy. Nobody within my family, my immediate family, there's 48 in my immediate family. None of them have this illness, thank God. And we're trying to keep everybody safe. With that said, my company is doing everything to keep everybody safe, to not get sick. We're using sanitizer. Have mine in the door. I use it every time I get back in the truck, wiping down the truck, using the mask, things like that. Just doing our best to not get sick, to not be in that position. But let's say it were to happen, other companies, whatever, it does happen. Think of how many truck drivers that are not working right now because supply is down in other areas of the country. There's 3.5 million drivers, truck drivers, in the United States that are trying to get out there and do some work. Not all of them are hauling toilet paper or food to the grocery stores. So there is a large supply of drivers. I don't think that would be an issue. The trucking industry is not going to have that type of an issue where 3.5 million drivers are going to get sick. I don't see that happening.
You know, Adam, one other aspect is with truck drivers, there's kind of somewhat of an inherent social distancing to their job anyway, right? You're in your truck alone a lot of times, but I know there's an effort to maximize that. Whereas before this happened, you may pull up to where you were picking up a load, you may get out, you may go talk to people. Same thing when you get there. You get out, you go find somebody, you sign documents, you use the restroom, get a snack, a cup of coffee, whatever. There's an effort to stop that so you don't interact and you don't spread germs. Very understandable. I spoke to a driver when I was at the rest area the other Friday who told me that when he got to one of his customers' destinations, he and his wife, their team drivers, had to wait for 37 hours. They got to their customer, had to wait for 37 hours. And, you know, we call that detention time in the industry. That's a very big number. But I guess the customer just didn't feel that they could safely take delivery of the load. That's how long it takes now to keep interactions to a minimum or not exist at all. So safety and health can mean time and money, and that's fine. Nobody's doing anything if they're not safe and healthy, but that's just one example to throw out there.
No, that's very helpful. You know, that we say, like you said, safety and health obviously key, but there are all these other aspects that can cause other kinds of problems, right? And one being, you know, we don't know exactly on the other end when these trucks stop and do a delivery, like, right, it could cause them to be late to another delivery. I'm just trying to, you know, figure out, expand that out a little bit longer. Like, they might not be able to, if there's delayed, they're going to have a delayed at other stops. I mean, so that's kind of the concern. Is just, you know, there's might be less stops that these drivers can go to because they're having to do, like you said before, if they have to check the temperature and they have these delays with the consumer or the business on the other end, it's just stopping them then from making the next trip.
Yeah, I'll just throw out one more thing, and I don't know if Roland wants to respond. You know, and maybe there's a bit of a misconception brewing. I read in an article recently, I think it was about food supply chain. They said, you know, long haul trucking is struggling to get the job done. I don't think that's what it is at all. To Roland's point, there's millions of drivers out there, some of them not working right now. I think where the issue comes in is if you have to wait hours and hours and hours to get your truck loaded and ready to go, and then the same thing on the other end, that's where the delay is. It's not with trucking's inability to do the job. It's just having to work with customers in the safest way possible.
So I'm going to backtrack just a minute, and maybe it is Connecticut. You talked a minute before. You talked before about how well Connecticut is doing relatively, right? Is there another state that either one of you can say that it's like, yeah, they really have this model down, and I mean, they're doing all the right things, or maybe that is Connecticut? What's your take on that?
Roland, what are you hearing from your fellow drivers?
Well, in Massachusetts, I live in Massachusetts. I work in Connecticut. In Massachusetts, they're trying to do the same thing as Connecticut. I mean, all the states are actually following suit. Wear the mask, wash the hands, use the sanitizer, all doing the same thing. They're all starting to jump on the highways and work on the highways. It's like they're all in communication with each other. I heard the governors are talking to each other, and all, you know, not only the Tri-County, but all the Northeast states are all talking amongst each other, trying to get on the same page with everybody. And that is what's flattening the curve that I've been watching in the news, and you know, trying to get this thing under control. But what,
so
one thing Joe was saying about a food supplier that was saying something about the trucking industry not being able to handle what they have or what they've produced. Remember, these large companies are not getting the small business money that's coming from the federal government. I don't know, maybe that's a bark in that direction, trying to get some of that attention. They start using big words, and the media might pick up on that and work for them, work in their favor. Yeah. But as far as the truck drivers are concerned, we don't see it. We don't see it.
And Joe, do you have any experience, or do you think Massachusetts, you feel, is the same, that they're all working well together?
There have been what I would call some blunders by other states that got everyone's attention. One of the first ones that comes to mind is Pennsylvania, and the Pennsylvania Turnpike came out and said that not only were they going to shut down the buildings at rest areas on the highway, but they were going to barricade the rest areas. So you have drivers who are literally called essential employees by the federal government, by state governments, but they still need to stop, use the facilities, rest, eat. And so the state of Pennsylvania's actions there didn't make any sense. I think they've backtracked a little bit, but there's been things like that, like one state who I would like to not name actually, but issued a ticket for a truck driver that had driven too many hours. Well, the federal government and his state government, by the way, said, no, you're responding directly to this emergency. You can go overtime a little bit. So there are some slip-ups here and there, but the federal government and most state governments have been pretty good partners to the industry through this.
And so you mentioned the federal government. We've talked a lot about the states, but the federal government, you feel like, has been working as a good unit with the states and has been in communication. I know, of course, we're just one state, so you can't speak for everyone, but how has been your experience with the federal government?
Yeah, just as one example on this hours of service waiver, the federal government came out and said, we grant this to the industry nationwide if you are in direct response to the emergency. If you're not, then you still have to follow the normal regulations. But that had never happened before. A nationwide declaration by the federal government in terms of responding to an emergency. That's how big of a problem this thing is. The Federal Highway Administration is the one who allowed the food trucks at rest areas provision. Drivers have to get annual physicals in order to be certified to keep driving. Well, that's very difficult to do right now. And so the federal government gave state driver's licensing agencies flexibility on how to respond to that. There's just so many, it's like a domino effect. One thing happens and then you have to think about 10 other things. But really, unless I'm missing something, Roland, nothing to complain about, I don't think, from our industry to the government on this.
Yeah, I don't see anything to complain about. Like you said, when you suspend the federal motor carrier safety regulations, that's huge. Like you said, it's never been done before, and we're in strange times. Strange times.
Well, speaking of strange times, and I don't, so I'm just taking a guess here. You know, gasoline prices have dropped. What is diesel? Has that dropped too, or is that staying the same for you guys?
I don't fuel up the truck. We have a service that comes in and fuels it up. I wouldn't know.
All right. Well, that's good. It's a good problem you don't have to worry about even when this all gets back to normal, right?
Yeah.
Yeah, I mean it's based on crude, right, which is plummeting. You know, I do take a glance at that. Every week we have a fuel surcharge calculator for some of our members who are in this one group, and it's been slowly ticking down. So, but hey, I mean, supply and demand. People aren't driving as much, and all of a sudden we've got this abundance of both gasoline and diesel, I think too. I had heard that at the start of this thing, there was some concern about, is there going to be enough diesel? Because there was so many trucks out there responding to the emergency that it was really getting used up. But I think that's come back to earth. I haven't heard any concerns about that. And I think that just goes to show why the price is ticking down.
My last question to both of you, you've been both very generous with your time. I'll start with you, Roland. Anything that I didn't ask that you feel should be talked about, an issue, something that you just want to address that we didn't get to so far in this interview?
Well, when you start talking about the trucking industry, I mean, I've been doing this for 36 years now. It's an industry that never stops. We never stop. It's like a river flowing through. You can put up a roadblock, we'll find a way around it. The food is going to keep coming. Everybody just needs to be patient. The toilet paper is going to keep coming. Just need to be patient. And that's what it boils down to. Like you said, like I said before, when everybody gets back to normal, you know, when they start acting normal, we'll get back to normal.
Thank you. And what about you, Joe?
Yeah, as far as what else would I add, I feel like we've covered a lot, and I would just take a moment to give a huge shout out to all the drivers doing their essential work, keeping us going. Roland, our friend Tony, who I've done a few interviews with, these drivers that I just met while I was out visiting one of the food trucks a week and a half ago. I took some time to talk to them, just kind of in passing while they were waiting for their food, and they're the most humble people. I just thank them for what they were doing, and they didn't think anything of it. That's the way most drivers are. Knights of the highway, as somebody brought that phrase back. It goes back to I don't know, decades ago. If you were broken down on the highway and you were lost or you needed help, ask a truck driver, and they'll, not only that, they'll pull over and be the first ones to help you. So it's great to see the appreciation for the drivers, because I think it's well earned.
I will echo that sentiment. And first of all, thank you both for your time. And Roland, thank you for going out there and doing the job when we need it the most, right? So we do appreciate it. And just thank you for explaining this issue a little bit more that's become so vital to us.
Thank you for having us.
Yeah, thank you, Adam. Thank you.
All right, stay safe. Take care.